The United States hospice market size and trends. The United States hospice market size was estimated at $37.9 billion in 2023 and is expected to grow at a compound annual growth rate (CAGR) of 8.07% from 2024 to 2030. The growth of the market can be attributed to rising prevalence of chronic diseases among rapidly growing geriatric populations. According to CDC data from November 2022, around 6 in 10 adults in the United States are suffering from chronic diseases, and around 4 in 10 have 2 or more chronic diseases. Hospice provides end-of-life services to such individuals and focuses on improving quality of life through palliative care. Diagnosis insights. Based on diagnosis, the dementia segment held the largest market share of 25.2% in 2023 and is expected to maintain its dominance over the forecast period. Dementia is one of leading causes of mental impairment among older adults in the United States, contributing to growth of segment. Population suffering from end-stage dementia is more vulnerable to loss of awareness and infections, and faces increased difficulty in communicating, which increases need for effective treatment. Effective end-of-life care prevents and relieves suffering and supports patients in the best possible way. It also reduces caregivers' burden and ensures optimal treatment decisions. Mortality rate due to Alzheimer's disease is on rise in the United States, which ultimately increases demand for palliative care. According to the Alzheimer's Association, in 2023, an estimated 6.7 million Americans aged 65 and above are estimated to be suffering from Alzheimer's dementia. Around 73% of those people are over the age of 75 years. The cancer segment is expected to hold a considerable CAGR in the near future, owing to growing prevalence of cancer among the geriatric population. The rising preference for palliative care among the families of these elderly patients is anticipated to fuel the segment's growth. According to an HPCO, in 2022, cancer was the third largest category for diagnoses, accounting for around 7.5% of Medicare decedents. Patients with a principal diagnosis of cancer had 55 days of care on average in 2022. Market dynamic. Demand for hospice services in the U.S. is expected to rise in coming years due to increasing Medicare reimbursement for hospice and growing demand for end-of-life services. In July 2022, CMS increased the payment for hospice by 3.8% compared to 2022, resulting in a payment of $21.7 million. Besides Medicare, Medicaid, other private insurance, and charity or uncompensated care providers cover the cost of hospice in the U.S. The number of hospice centers in the U.S. is constantly growing due to the aging population and the increasing number of patients with end-of-life conditions. According to CMS's 2022 Hospice Information Gathering Report, around 1.6 million Medicare beneficiaries received hospice in the U.S. in 2019, and Medicare spent approximately $20.9 billion on these services. Currently, hospices have adopted technology substantially, and over 84% of respondents use telecommunications technology to deliver services to Medicare patients, with 82% saying they use two-way audio-visual communications. This adoption of technology has positively impacted the overall market. Type insights. Based on the type, the market is segmented into continuous home care, routine home care, inpatient respite care, and general inpatient care. The routine home care (RHC) segment held the largest market share of 90.7%. In 2023, due to high comfort, favorable reimbursement policies, and routine visits by licensed nurses, physicians, and aides, it has an advantage of receiving constant attention, companionship, and family involvement. In 2022, Vitas Healthcare generated the maximum of its revenue from RHC. According to an HPCO, in 2018, 89.81% of total Medicare spending was for RHC, an increase of 17.8% from 2014. Other settings, such as inpatient respite care, continuous home care, and general inpatient home care, are anticipated to grow at a steady pace over the forecast period. Continuous home care (CHC) services are short-term services provided at home where symptoms cannot be managed. Furthermore, as the main aim of CHC is to manage acute symptom crises at home, it significantly reduces hospital admissions. A study published in NCBI found that hospice CHC decreases the likelihood of hospitalization and non-enrollment. Thus, it provides comprehensive end-of-life care. These factors are expected to drive segment growth. However, inpatient home and respite care services are provided in healthcare facilities as symptoms cannot be managed at home. The inpatient respite care segment is expected to grow owing to supportive reimbursement policies for respite care and increasing focus on the mental health of primary care providers. Location insights. Based on location, the market is segmented into hospice centers, hospitals, home hospice care, and skilled nursing facilities. The hospice center segment held a maximum revenue share of 58.3% in 2023, owing to benefits offered by these facilities. These centers prevent the need for hospitalization and offer more balanced and controlled care settings. Hospice centers can be helpful to patients who need round-the-clock care or do not have a caregiver. Hence, many organizations are launching hospice centers at different locations, which is expected to contribute to the market's growth over the forecast period. For instance, in February 2022, Chemed Corporation, a subsidiary of Vitas Healthcare, opened 2 new hospice inpatient centers in Florida. This initiative by Vitas Healthcare is expected to increase services to 900 patients annually with the opening of new centers. The home hospice care segment is expected to witness significant growth over the forecast period. This can be attributed to the growing preference of patients and family members. It offers a more comfortable environment to patients along with freedom for visitors. In addition, it saves family members traveling costs required to reach patients. It is a more cost-effective option compared to long-term hospital stays. Key companies and end market share insights. The market is highly fragmented, with a majority of market share held by key players. Major players in the market are adopting several strategies, such as geographical expansion, partnership and collaboration, and technology integration in the business to capitalize on consolidating the industry. Key players are strengthening their position in the market through activities such as partnerships, collaborations, mergers, and acquisitions. For instance, in March 2023, Vitas Healthcare partnered with Wellski to streamline its operations for advancing innovations with the Wellski Hospice and Palliative Solution. Key the United States hospice companies, Chemed Corporation, Vitas Healthcare, LHC Group, Inc., Amedisys, Kindred Healthcare, Inc., Brookdale Senior Living, Inc., Accent Care, Inc., Crossroads Hospice, Seasons Hospice and Palliative Care, Heart to Heart Hospice, Oklahoma Palliative and Hospice Care. Summary. Based on the content above, it is not difficult to observe the current state and development trends of the hospice care market in the United States. No single provider dominates the market. Mergers and comprehensive, diversified developments occur frequently. Routine home care remains robust. Hospice care centers are developing rapidly. The dementia segment ranks first in market share. The use of remote high technology is increasingly valued.
这么好内容，不点赞、不转发、不收藏啊！